Good morning. My name is Paloma Muñoz. I am PhD student in Hospital Clínico San Cecilio in Granada. I would like to express my gratitude to the scientific committee for selecting this study as learning poster. As a small reminder, we are included in CORIS resistant and subtype work package, which is under development since 2007 with annual updates. The aims of this study are to present the 2023 update of transmitter-resistant mutations in Spain, as well as to present the results on clinically relevant transmitter-resistant in antiretroviral therapy recommended as first-line treatment in Spain in accordance with Stanford algorithm. On the other hand, to update the prevalence of subtype A6 and RAMS to rilpivirine due to new long-acting therapy. And finally, to know the prevalence of M1A4V mutation in PrEP uses. As result, 2023 update, a total of 548 sequences has been included in this study. And about surveillance drug resistance mutation prevalence was 12%, having the highest prevalence in NRTIs and the lowest second-generation integrase inhibitors. As you can see in the table, the most prevalent mutation for NRTIs was M1A4V, and for NRTIs, K103N. About clinically relevant transmitter resistance in 2023 prevalence was 14.7%. As you can see, the majority of this prevalence was due to NRTIs. Doravirine was the drug in this family with the lowest prevalence. And we also studied RAMS to rilpivirine in accordance with the International Antiviral Society recommendation to monitoring this specific mutation in context to the new long-acting therapy. We identified 40 RAMS to rilpivirine, and the most prevalent mutation was E1388A. And regarding to the distribution of subtype, the most prevalent was B, followed by recombinant form O2, AG, and subtype A divided in A1 and A6. Regarding to the clinically relevant transmitter resistance in Spain over the years, as you can see in the graph, has been decreasing, the line in red, from 2007 to 2023. A slight decrease in NRTIs can be observed due to the removal of this drug as first-line treatment in Spain in 2014. As you can see, M1A4V mutation has been detected overall this year. And in 2022, we included for the first time in demographics data survey if people with this mutation had taken or were taking PrEP. We identified 2 people in 2022 with this mutation and 6 in 2023. And regarding to the demographics data, 6 out of 8 people had taken or were taking PrEP. All were Latin American, cis men, with high educational level. Transmission route was men's sex with men, and 4 out of 6 had other sexually transmitted infections. As conclusion, the highest prevalence of transmitter resistance is conferred to NRTIs, with doravirine being the drug in this family with the lowest TDR levels in 2023. Transmitter resistant to PIs, integrase inhibitors, and lamivudine and trizitabine remains at very low levels, with only 1 person who lived with HIV presenting complete resistance to second-generation integrase inhibitors. In 2023, the M1A4V mutation was mostly detected in people who were taking or had taken PrEP. And finally, our results reflect the epidemiological situation of TDRs and level of primary resistance to first-line antiretroviral in Spain. Thank you.